No problem. Hello. So today I am joined by Angela, and Angela is going to introduce herself. But as always, I'm always super excited to speak to my guests because I learn so much from each and every one that we have on the podcast. And today I'm joined by Angela, and we're going to talk about sex and sexual relationships and emotions probably surrounding all of that. I'm really not sure where the conversation is going to go, but I'm really interested in learning a little bit more. So, Angela, please introduce yourself and tell us your company and what you do.
Okay, so I have sort of several hats, I guess. I'm a GP by training, a British Menopause Society menopause specialist, but I'm also a clinical sexologist, which means I've been trained in psychosexual therapy and sexual medicine as well. So I can kind of look at it from a brain perspective and also from a
Mhm.
body perspective.
Wow, and that is so important because I get a feeling, again, I'm sure you're going to enlighten us about this, but it's all connected, right? It's all kind of, you can't
Yeah.
isolate one from the other.
No, so I was taught in something called a biopsychosocial model. So it's a bit like a Venn diagram with your kind of psychological well-being, what's happening socially for you, and then what's happening in your body. And I think sex and sexuality and our interest in sex fits in all of those areas. So yeah, I
Mm.
find it really helpful being able to look at it from all directions.
Yeah. And then I suppose the key thing and the key question for me is how does menopause impact? Because it impacts certain aspects you've just talked about, your kind of your social well-being, your communication, your relationships with
Mm.
everyone changes, and even with yourself it changes. So how have you found, and what have you found has been the impact of menopause on sexual desire, sexual relationships? Does it have an impact?
Yeah, I mean, actually, I did sexology training first, and because I was using it all the time with menopausal women, that's why I did my menopause training because it was so clear that it's a tipping point for a lot of women. So
Mm,
I think, I mean, I see people with low desire, I see people with loss of arousal, people who feel quite numb or lose the ability to climax. But there's also quite a lot of identity-based stuff and relational stuff, and people that go into menopause because of cancer or surgery. So it's really individual. But I think for a lot of people, the loss of hormones makes a sort of is a tipping point for them where it becomes much more difficult to get the same response out of your body unless everything is kind of perfect. So it shows up
yeah,
other areas maybe where things aren't working so well.
yeah. And I suppose, I mean, I hear it, I don't think the women I speak to aren't openly coming forward to talk about their relationships or to talk about their sexual relationships. I think we're now
Yeah.
becoming a bit more confident in talking about um, issues that we might be having within relationships. So whether it's with our children or our partners, people at work, or whether it's our partners, um, but still there feels like there's this real um, lack of awareness, lack of I wouldn't say lack, but also kind of a taboo. Like we can't talk about it because surely there's something wrong with me if this is how I'm feeling now. This must be all about me.
Yeah.
Have you sort of found that as well?
Yeah, I mean, I think it's easier, I suppose, like it is with men, it's easier when we think there's an easy solution. So I think now that people think that they can ask for testosterone and maybe that's going to give them a solution to what's going on, it's a bit easier to voice that people are having problems in the same way as, Viagra in male-bodied individuals brought that conversation more up into the fore. But I see is a lot of women where testosterone hasn't worked. And then I think it's really difficult because then you're faced, with having to confront, well, what else might be going on? And that's much more difficult territory for a lot of people. I think it's much more vulnerable territory for a lot of people.
Hmm. So, I know you said the hormone changes was the tipping point for a lot of people.
Yeah.
But I suppose the other thing, if you're saying that, yes, again, some people are like, well, yay, I can go and get testosterone and, that's going to help with my libido. It's going to help with um, my sexual desires, my sexual life. But I suppose if you're saying that doesn't always work, where would somebody go from there? How would somebody even begin to think about what else it is that could be happening or what they could do?
Yeah, I mean, I often say that everything, or most of what I see, and I take referrals in secondary care, so people come to see me in the NHS or come and see me in the private clinic with loss of libido, and that's kind of the phrase that everybody uses, is that it's loss
Yes.
of libido. But
What
actually,
does
when
that
you
even
start
mean, I
to,
suppose,
yeah,
Angela? Sorry,
exactly,
I
and
was going to
it's
say,
actually
what is
really,
that?
well, to me, loss of libido would be about that sort of that desire for sex, like that appetite for sex or interest in sex. It might be sexual thoughts or dreams or the willingness to kind of participate in sex. And even that is granular. Sometimes people have spontaneous desire. For a lot of
Mm,
women, we experience that as responsive or receptive desire. Something will happen or someone else will initiate something. But losing that is kind of loss of libido. But we don't do stuff that we don't like or that makes us feel bad or that isn't
yeah,
pleasurable or is actually uncomfortable. So a lot of the time, it's people have got numbness, they're not feeling any arousal, they don't climax, and that makes them feel rubbish in sex because they're worried about what their partner thinks. And actually, when you ask questions about what sex is like and what's happening and, what was happening before and how does it compare, then you can kind of start to dig into what's going on for people. And I think that's why testosterone, it works quite well in some women to sort of improve interest, and it works quite well to look after the health of the tissues and the wiring of the response. But there's a lot of other stuff that can kind of go wrong. So I just ask lots of questions and try and figure
yeah,
out what's actually happening to people.
yeah. So I suppose I think that leads on to, you were saying sort of lots of other things that can go. What are those things? What are the sort of things that could be happening, that could be, as you say, kind of going wrong? And again, I think a lot of women will always, I think they turn inwards and blame themselves quite a lot. There's something wrong with
Yeah,
me. There's
massively.
something wrong, and I think again, it's that whole culture about how women are brought up to kind of just almost immediately assume that it's something that they do. Um,
Yeah.
but how does that? What can go wrong?
I think even that last bit you said is quite interesting, because a lot of women I speak to think of themselves more as a sexual partner rather than thinking of their own experience of sex as kind of central. So that they come to me with, my partner's very good, but God, there's a long list. So in your body, you can certainly get reduced like physical arousal, that sense of like blood flushing into the area, and that diminishes. Sensory sensation can reduce. You can start to get leaks. Sometimes people find they're really paranoid that they might leak a bit of urine, and that puts them off. There can be pain if you're not lubricating. There can be pain because there are changes in the tissues.
Yeah.
There can be tissues can split. You can get, say, real
Oh.
difficulty in climaxing. There's just like a million things. Your breasts get less blood supply,
Mm.
so sensation in that area can decrease. Brain wise, we're changing, like our identity shifting. And I was taught that there's four pillars that our sexual function sits on. And one of those is our sexual identity. So whenever we change, if we've been fertile, then we're infertile. Or if we come out, in from a relationship, out of a relationship, or have an illness, or go through menopause, it shifts our sense of self, and that shifts our sense of sexual identity. So people lose confidence, self-esteem. They lose their sort of sense of feeling sexy and desirable, which can be really difficult. And then there's all the relationship stuff and caring for parents and kids and stress and work, and
Yeah,
there's
yeah,
a
and
thousand
we're all,
things.
yeah, there are so many things, aren't there? I mean, having said that, I do have to say that I know quite a few women who actually um, almost felt much more liberated when they were going through the menopause, and actually definitely
Yeah,
post-menopause, where actually they were much more sexually active than they had been before within their relationships, and much more open, and
yeah,
feeling that feeling of liberation and being able to kind of explore their sexual desires and all of that in a much more open way. So I mean, I
yeah,
have heard that side of things from certain women I've spoken to, not many,
yeah,
the majority. It does seem to be that it does seem to follow on, doesn't it? That actually, the women I see, even though they're not speaking to me about what's happening within their sexual relationships, it is, you can see that they've got low mood, they're exhausted, they have got such low self-esteem, they just don't know what on earth, they can't remember that they think they've got Alzheimer's, and they're thinking all of this stuff that's going
yeah,
on with them. It's almost like the last thing they need to think about is And then it does become that thing of it's almost like a duty that I'm part
Yeah.
of a relationship and this is what I have to do. And it just completely changes that whole dynamic, I think.
Yeah, I mean, you're right to point out it's not everybody's experience. I definitely see people that, get quite a surge of interest actually as they go through perimenopause sometimes when their hormones are fluctuating and like their circumstances might change. Seen quite a few women who've gone through, life-threatening illness or something quite significant that have actually almost recentered themselves afterwards and get, get quite a different sense of self and can really rediscover themselves in that setting. But I think you've got to remember though that the physical stuff is very real, and we do the hormonal impacts on the tissues are quite like easily to demonstrate in you can look under a microscope and see that the tissues get thinner or that there's less blood supply that goes in, and we accumulate stuff that can go wrong with our health generally. So if you end up on antidepressants or blood pressure medications or whatever, that stuff all interacts as well with some of the signaling that your body needs to feel arousal and send it off to your brain, and just the processes that happen. So I just think it is really variable, and there is, oh God, we're always saying there's no one size fits all solution to any of it, but it's really true with sex, because sex looks very different for everybody. It has a different meaning for everybody. Some of it's solo, some of it's partnered. There's just so many variables for people about what's going on. I guess my thing, you can't reduce all of that to saying that testosterone is going to fix it for
No,
everybody, because it doesn't. And then I think people feel awful when it doesn't.
yeah, yeah. So I suppose if people, how do you support women, couples, people that come to you, um, saying that they feel that everything has changed, their sexual function has changed, their desire has changed. How do you support them?
Yeah.
What do you offer? What do you do? Like, yeah, what do you
What do I
do?
do? So I work in NHS in private, it's Vice Pair Health, and I do some voluntary stuff as well. And I'm trained in men and women. So if I'm seeing a couple, a heterosexual couple, I can actually look at male function as well as female function, which is actually quite useful, because people don't just exist in a little bubble on their own. They kind of the relationship is often the thing that needs to be looked at. So I ask a lot of questions. I ask a lot about what sex was like, about some of the sexual development stuff, about we talk about scripts, so we talk about the ideas that we absorb as we grow up about what normal looks like and what desirable
Mm,
looks like, and unpicking a lot of that can sometimes help you to understand a little bit more about the meaning of what's happening and how somebody might be feeling about it. And then it's about unpicking what's happening in their wider body, but also specifically what's happening with sex. So what happens on your own, what happens in your, when you have sex with a partner, what are the feelings, what's changed, what's not working, and sometimes it's generalized and sometimes it's really quite situation
yeah,
specific.
yeah.
So it's like a jigsaw puzzle. It's like there's
Mm,
about 20 pieces that have changed that I need to kind of put things in different areas, and sometimes I will help the partner as well. But I think it's about that wider, broader approach, I think, rather than pinning all of your hope on one particular intervention.
mm. And how would somebody, sounds like a daft question, but it's not actually. How would somebody know that they need help, and how would somebody find out where to go? Like,
Do
the
I
reason we're
don't think
doing
people know that you
podcasts.
can do
Yeah,
stuff.
yeah,
It's like I saw I've been doing some consultations this morning, and I working with men this morning and working with women. And I don't think that people realize it's possible to do something about some of the stuff that they may have put up with for years. So I think, when women, especially with the scripts that we're exposed to, when something doesn't work for us sexually, we don't normally go and tell a girlfriend that we don't get very good orgasms and we don't really understand what all the fuss is about, or we fear that we're a bit broken and something's wrong
yeah,
with us.
yeah.
So I think a lot of the time, people don't ask because they don't know that you can do something about it. So I guess my answer to the question would be, if it's affecting you and impacting you and it's making you not feel so good about yourself or about your relationship, it's probably worth a conversation with somebody who understands it properly. So that's my setting, but there's also quite a lot of sex and relationship therapists in different settings that don't do the medicine, but any of us can kind of look at the overall picture and try and
Mm,
work out what might need to shift or the kind of conversations we need to have that may
yeah,
help people.
yeah. I sometimes think as well that people struggle with the language to communicate
Yeah,
what it is that they're feeling because they don't have the words, because it's not something we're ever brought up to talk about.
no.
We just don't talk about sex. We don't talk about relationships. We don't talk about desires. It's such a taboo. We talk about menopause
It's
being
kept
taboo.
secret.
Yeah, it's a
And when you
real
read about
secret.
it, if you read about it, it's stuff. And like I get approached by people to do things like, 10 top tips for orgasm, or, 3 ways to give your husband a better time in bed. And that's not what I do.
Uh,
And I think whenever we talk about sex, it's in that kind of achievement based, how to be a better sexual partner based kind of model, which I don't think is very accessible for lots of people. So, I mean, we're taught the language. So I find that people can speak really easily when I give them the words to use. So we just
yeah,
ask the questions and kind of like put it out there as being really normal, and then people pick up with it. And generally, I think it's nice to be given a safe space to talk about it,
yeah,
and to explore
absolutely. And
things.
yeah, and I mean, there just needs to be so much more awareness raised about the fact that there are people like yourself who are able to help, are able to kind of give support, advice, and you know, eventually, ideally, kind of get people to a much more comfortable place. Um, I just
Yeah.
kind of, I was just a thought that popped into my head. I think, do I'm talking about women specifically because we're talking about menopause. Does that shift in hormones and shift in everything that's kind of going on because of that, loss of such a significant hormone, estrogen, and then changes in progesterone and testosterone? Do women actually change entirely how they feel about their sexual identity? Does that kind of happen as well? Can that be, you can go from kind of, well,
I've,
this is normal to having sex. I mean, it's normal to have sex like this, to completely
mm,
unleashing like, no, actually, I don't enjoy it anymore. This is not what I want to do, or I love it and this is what I want to do.
so the like if you're looking at the body based bit only, if you're looking at what the hormones do only, I definitely get women that come in and say that they feel like they've just gone dead from the waist down, that that their sensation of being touched has gone. And that's definitely partly hormonally based, because we send blood to different places when we haven't got estrogen going around the system. And there's lots of receptors all the way through that area that for androgens, for testosterone, as well as for estrogen. So when you get real sort of physical changes, and I get women that look at their partners and simply cannot fathom that they ever wanted to have sex. Like it's just gone, and actually they're the ones that often really respond well to the estrogen and the testosterone, because in the same way, it's a bit of a weird analogy, but in the same way as I've got a 9-year-old child at the moment. I've got a son who does not, and we talk about sex at home, and he does not understand why somebody would want to do that. Yet I know that in 5 or 6 years' time that change is going to happen.
Yeah.
So obviously the hormones affect our brain, and they change things, and they coordinate interests and so on. So we know that women's natural interest maps to ovulation when their estrogen and testosterone is higher,
Yes.
and like behavior, we have more sex, we respond more. So it definitely does change people quite significantly. But like I said, sometimes it's just the tipping point that the relationship was going off the boil anyway,
Mhm.
and this is the thing that's kind of changed it. Or your attractive, your sense of being attractive and confidence kind of like not goes out the window, and you
Yeah.
can't find that sexual self again. So sometimes it really is brain based. And if you get anxious or distracted during sex, that can massively dial down how much you can feel from your body. So not only have you got the hormone stuff going on, if your brain is somewhere else entirely, I always use the analogy, if you give blood and you look away, you feel it a little bit less. We
Yeah.
do that constantly with our bodies and sex. So it can just be
Mm,
brain based.
yeah. Oh, it's fascinating. It's been such a fascinating conversation, I have to say. I think definitely we need your information and details on where people can find you and all of that. But before that, it's a question we actually ask everybody, and I wonder whether it would be related to your profession, to what you do. But one of the things we always ask our podcast guests is whether they would be kind enough to share something, a ritual or a routine that they do every day that they feel that they could share with our audience, that the audience might be able to do as well to help them feel,
Okay.
better.
So yes, in an indirect way, it's linked. So I think it's about getting out of your head and into your body. So this is
Mm,
the idea of kind of, so for me, I think the idea of a mindful time where, you know, this idea that you sit still and you vacate your brain of thoughts is impossible for me because my head's really, really busy. So
Yeah.
I find my quiet space through exercise. I create time in my week where I'm exercising and I'm in my body, really, really conscious of my body as a way of switching my brain off. Um, so for me, that's cycling and walking. You know, that's what I do. And I do a
Mm,
bit of a scan as I go through. I consciously check in, what can I smell, what can I see, what can I hear, what can I feel. I bring myself into my body and really make myself aware. And that the underpinning part of that is what I do with my patients sometimes when they're struggling to be present in their bodies and notice sensations. Or we use a lot of mindfulness
mm,
techniques with people, even people with pain or lost sensation or lost libido or whatever. So that I would share that. And I think women at menopause really need that because we have massive lists, massive like to-do lists and jobs and a million things going on. And we're on our phones and we're on our computers and we're never just doing one task, you
no,
know. So
no.
actually sex is a very much a one task thing. You have to kind of
Yeah,
learn to do that. So
yeah.
putting that in your week would be my ritual or whatever that I would say to people.
I absolutely love that. And it is something I have to say for me that I resonate with completely. I turned to yoga, to practicing yoga. Um, and I still practice it today. And
Yeah,
it's changed from a very dynamic practice because it was an Ashtanga yoga practice to it's still an Ashtanga yoga practice, but it's completely totally about the breath and about where my body is right at that point.
yeah,
Where is my hip? Where is my leg? Where is my arm? I can't think of anything else because otherwise I lose concentration and focus. And that
exactly.
yeah, it helps so, so much. It's such a, I love that thing of, what can I see? What can I hear? What can I, because that just brings you again kind of away from the everyday nonsense that
And the
it just drives you
commentary,
nuts.
you know, with sex, there's a lot
Constant.
of commentary for people. So there's a lovely exercise that Laurie Brotto does where she gets people to have a raisin and like just look at it and describe it and all the colors and the, you know, the sort of little marks on the surface, and then smell it and then put it to your lips and then put it in your mouth and then bite it. And all the way through, you're trying to pull every single bit of information out of your body. And if we do that with touch, we focus in much better and we get much better feedback, and the loops that make us interested in sex get stronger.
Yeah.
And that stuff really underpins a lot of what we have to do to get, as well as the hormonal stuff, which is really important. It's not that I don't think it
Yes.
is. It's
No,
just
no, no.
it's like this much bigger around it, if that makes any sense.
Yes, no, it
So
does. You've
yeah,
got to it's just reconnecting, isn't it? To
yeah,
yourself in a different way now. We're having to do it, maybe work at it, circumnavigate
yeah.
it in a slightly different way, which is what
Or just look at it again, like,
yeah.
you know, they say that you need I've got a good friend who says for change you need a good push or a good poke to make you make a change. And I sometimes think menopause is quite like that, isn't it? It really does shove you, or you know, shove you off center and make you kind of rebalance. And if you take that and it becomes something that's kind of successful or positive because you adjust around it, sex is just one of those areas that
Mhm.
theoretically we can adjust around if we look
Yeah,
at it and work out what we need now.
yeah. No, totally agree. It's brilliant. It's just been it's been really enlightening talking to you because actually I think, what I feel we've covered is that actually there are changes that happen. Hormones do have an impact on that, but there's so much more than just that.
Yeah,
And actually, as we always say with HRT, with anything we're looking at, um, it's you can't just kind of really fix it by just kind of doing that and pressing
no.
this or taking that. You have to look at it in a much wider way. And there is help, and that's the other thing. There is help. There are people like yourself who are able to help and support couples, women, men, whoever is being impacted by this. But so Angela, where would people find you? How do we?
Where
What's
are
your
we?
website? Yeah, please tell us where
Okay,
we can
so
find you.
we're online. There's two of us called Angela that are equally qualified and set up just to confuse you. And we work with other Angelas as well in like gynae physio. So we only like Angela. But there's the two of us. It's Spiced Pair Health, and it's online. We talked about setting up face to face, but actually there's not that many people qualified in the area, so we thought online made us more accessible. And we also work with charities like Maggie's for ladies that have been through things like cancer that have impacted sex. So some of what we do is available through their setting, free of charge, as well as the paid stuff that we do online.
Wow. That's amazing. And do you have any social media? Are you on social media anywhere?
Yeah, we are, although we're not brilliant at it, but we do. We're on Instagram, we're on Facebook, and we occasionally get brave enough for Twitter, but Twitter's quite
Right.
scary. So,
And I know
and
I'm not
LinkedIn.
there. I'm not good with Twitter at all. But on Instagram, what's your account on
I
Instagram?
think the handle is it's at Spice Pear Health, and I think it's the same for Twitter, but without the EA. It's Spice Pear Health because there weren't enough characters.
Okay, no, that is fantastic. Angela, what a pleasure speaking to you. Thank you so much for giving us such insightful information, and hopefully, all our listeners will feel well, they'll feel a bit more heard, I think, if they do listen to this. So thank you so much for joining us
I hope
today.
so. It's a pleasure. Thank you for having me.